Hey, yo, have you heard about the study where precision teachers increase confident thoughts in an adolescent with autism? So, this is a story about how a 15-year-old girl with a diagnosis of autism and clinically diagnosed with post traumatic stress disorder and depression was able to change the frequency of her despondent or problematic thoughts with 1 minute timings. This intervention that used precision teaching and behavior science was cost effective and easy to implement. Let me tell you about it. So, first, she was assessed by a local university psychology clinic before the study, which diagnosed PTSD after the participants self reported feelings of depression, anxiety, and suicidal ideation to a school counselor. She also reported frequent thoughts reflecting a negative opinion about herself. The dependent variable or thing that they were trying to change were DTs or despondent thoughts. They were private events or inner behavior that created fear or worry about future events accompanied by a physiological change such as increased blood pressure noticeable to the participant. Some examples of DTs included I'm stupid, I'm a failure, and I hate myself. Prior to the intervention, the participant generated a list of approximately 30 thoughts that were measured via the participant's self report. The participant referred to these exemplars until she can be sure to identify the DT. So, first, during baseline, the participant collected data on the number of despondent thoughts and feelings with a mechanical counter like this. She set the timer on her cell phone for 30 minutes and began self recording. Now, here comes the intervention. She began counting confident thoughts during a 1 minute time trial every day. She listed approximately 30 confident thoughts, such as I'm smart, I can do this, I'm a good friend, I like who I am, I'm a success. Similar to DTs, the list of self generated confident thoughts was used to teach the participant to recognize a confident thought. Here's data on the standard acceleration chart, but I'm going to make it a little bit easier to read. Here's that same data on a standard acceleration chart segment commonly used for journals due to space concerns, but faithfully reports levels of trend or acceleration, level, and bounce or variability. Towards that last day of data collection, she started feeling a lot better and more confident, so she asked to stop the intervention. We love seeing researchers respect assent, and that's what happened here. The participant was given the option to restart the intervention at any time she wanted. She was given the Beck Anxiety Inventory and the Beck Depression Inventory once again, and the results translate from borderline clinical depression at the beginning of the study to a mild mood disorder at the end of the study, leading to a change in her clinical diagnosis. But perhaps the most significant outcome was the fact that she no longer reported having suicidal ideation after the intervention. She even showed some of her friends how to do the timings when they told her that they felt sad. So, what does this tell us? Individuals with autism who are taught to detect and report their feelings can use 1 minute timings to change the frequency of problematic thoughts and feelings. Now, I want to know what you think. Do you think that more people should use this treatment for this kind of problem? Let me know in the comments below. I'm Jared, a precision teacher, behavior scientist, and PhD student at Penn State, Black and here to educate.